President Trump unveiled his America First healthcare plan and signed a series of executive orders to protect Americans with pre-existing conditions, end surprise billing, and introduce more affordable public options. I spoke with epidemiologist and former senior healthcare advisor to President Trump, Katy Talento, to get her take on the matter. Take a look. So I'd like to start off, what are some of the key points that President Trump's America First healthcare plan covers that Obamacare does not?
That's a great question. There's still so much left to do in our healthcare system. Our broken status quo has really just been exposed even further by the COVID crisis. So the president is stepping up and taking on one of the biggest black boxes in healthcare with his executive order, and that is shining the light on secret prices and corrupt billing practices by hospitals and insurers. Right now, Stephanie, if you go into an emergency room, like a mom, I've got a son who's destructive and we're always in the emergency room. You go in for a few stitches, you get a bill for $5,000. You don't know why. You have no way to predict that in advance. Knowing the prices of something before you buy is essential to our free functioning economy. And so there's a reason why healthcare is so broken. There's a reason why there's all this price gouging and surprise billing and scaremongering of people who just want to help, who just want to get help at their most vulnerable moments. And so the president's plan would require hospitals to post their secret prices on public websites, and then he would grade them for if they're complying with that on a wall of shame on the HHS website.
And as you mentioned, healthcare has become a hot button topic, notably because of COVID-19. How does his healthcare plan directly address that?
So one of the ridiculous examples that we're seeing in COVID is you don't know how much a test costs. We're all required to go, if you get exposed to the pandemic, we're required to go get a test, maybe before your kid can go to school, maybe before you can go back to work. This is essential. We have to be able to go back to work and send our children to school. And so we're asked by our public health departments or local officials to get tests. But tests can range from anywhere, recently was found, anywhere between $20 and $850. People don't have that just sitting around. Half of America has less than $500 in their pocket today.
My question, where President Trump announced he's also planning on mailing $200 discount cards to Medicare beneficiaries to use for prescription drugs. But how would this affect taxpayers?
So I think most people are really struggling with the cost of healthcare. And one of the biggest costs of healthcare are drug prices. The president's initiative would provide some temporary relief to that problem, and he would pay for it through savings that he's going to get by part of his health plan, which is to eliminate global freeloading. Right now, foreign countries are charging way less for their drugs because they know, those pharmaceutical companies know, that they can just make it up on the backs of American patients. The president has put American patients in the top priority of his healthcare plan, and the way his transparency measures would work, the way he will end surprise billing and really force prices to work in a free market economy, that will enable new and disruptive and innovative solutions such as cash pay programs, healthcare sharing ministries where people negotiate with doctors and hospitals in advance to get the lowest price. There are jobs and employers out there that are paying people to use shopping apps that are based on going to lower cost, higher quality providers. These types of solutions will be enabled by the president's plan, including his drug pricing plan.
And lastly, the Trump administration is backing a GOP-led lawsuit to overturn all of Obamacare, including the Affordable Care Act's protections for people with pre-existing conditions. Now that President Trump signed this executive order, how does this affect the lawsuit?
So I think the executive order really lays down the law for President Trump, that no matter what happens with the lawsuit, patients with pre-existing conditions will have protections in any Republican plan and in any law that he would sign. So it's really just a communication to the American people that he's not going to abandon them, especially the most vulnerable.
Want to see more videos like this? Click on the link below and subscribe to One American News on YouTube, and call your cable provider and kindly demand that One American News is added to your lineup. Call and subscribe today.